Good morning, everyone. This is Dr. Zarina Begum, Professor and Head of Department of Community Medicine, Manipal Tata Medical College, Jamshedpur, Jharkhand, from India. First of all, thank you. I'm really honored to have this opportunity and share the stage with renowned speakers, and very humble to interact with the global audience. Today, I'm going to talk about public health leadership. So, to know about public health leaders, uh, I have kept some pictures uh, who's got very interesting stories behind it. As you can see, John Snow, who has found cholera epidemic by using simple fundamental tools of epidemiology. Likewise, Robert Koch was found the infectious diseases through microbes and microbiology. Edward Jenner, who has pioneered the concept of vaccines. He is also called as the father of immunology. And Louis Pasteur, who is famous for pasteurization, who discovered the principles of vaccination, also the microbial fermentation. So these public health leaders has shown us that public health and medicine was seamlessly joined in early 80s and 90s. The schism started after that, where medicine was considered as a separate entity than public health. So as I told you earlier, there was a gap, and now we'll know about there are some commonalities between clinical medicine and public health. So they both focus on disease control, the quality care, research ethics, the guidelines of treatment, training and management. However, the relationship between the two, they kept getting wider as the medical education established. Abraham Flexner, the first to establish the medical education and devised the curriculum to train students in the line of curative care. And later in 1950, Welch report, he has mentioned the importance of public health, which focuses on holistic health. And after that, the trend of establishing the separate standalone schools of public health was there. And now we all are having this public health institutes. So doctor is the leader in a healthcare team. However, a healthcare professional when works in a community, so they could be a public health leader who focuses not only the problem or the solution, rather he will focus on eliminating the root causes which generates the problem. So guys, let's know about the schism more, which is a challenge to move forward. So clinical medicine is more about diagnosis and treatment. It's more for profit and money, provides more care but with a rising cost. Whereas public health focuses on prevention and promotion, is for non-profit and provides better health for all. But the important aspect to look on is the current crumbling infrastructure. So if we could combine medicine with public health to redesign healthcare system through leadership. So leadership is a practical skill encompassing the ability of an individual, group, or an organization to lead, influence, or guide other individuals or team or an entire organization. And leadership involves roles played out in a highly visible, regulated, and complex environment, rather, we could say a crowded stage. and working across boundaries and organizations continually in a state of flux and reconfigurations. They're producing highly skilled, socially accountable professionals. But here we need to know the difference between a leader and manager. A leader is a person who directs, guides, and influences the behavior of a follower towards attainment of a specific goal. But manager is representative of an organization, responsible for the management of the work of a group of employees and take requisite actions whenever required. Manager is by virtue of position or chair. Leadership is about qualities and traits of a person. Managers are something where he or she reacts to change, but a leader, he approaches proactively to promote the change. So there are many uh, leaders, and everyone has different leadership styles. But Goldman in 2000 proposed six leadership styles based on the emotional intelligence of the person. Could be coercive, authoritative, affiliative, democratic, pace setting, or coaching type. So let's know more about it. So the first one is called as the coercive or commanding type of leadership, where you need to fix a problem quickly and effectively. So the leader will say, "Do what I tell you." Second is authoritative, or it's a visionary kind of leadership, where the leader will give the team a general direction, a goal to achieve, and he or she will let them reach by whatever way they want. Third is affiliative type, where people come first. So they create a positive environment for their team members. They give praises to them. They rarely receive any corrective advice, leading to the team get confused. And the fourth one is democratic, or it's also called as participative leadership. The team member has a voice and the workplace is flexible and collaborative, where the team members' opinion matters. And the fifth one is called pace setting type of, where you will have the leader will walk the walk and talk the talk. Means he will set an example. So he will do, and he will show the team members. So they will show and tell the do as I do now. And the last is called a coaching type of leadership, where the focus is on personal development of the members. They work for them, and who are this type of leadership works when the member is open to improvement. So there is another theory of situational leadership, and this model speaks about the relationship between a directive behavior and supportive behavior. As you do, the directive behavior is high, so you will be more using directive kind of leadership style, then become coaching and supporting, where your supportive behavior is high, and it becomes delegating when you have the supporting and directive behavior becomes low. So this model will show you how the leadership style changes according to the situation. So now you tell me, which leadership style is the best? So I would say there is no right or wrong, also not one size fits all as far as leadership style is concerned. A combination of different leadership styles needed to fit various situations, challenges, and obstacles. A leader should be both successful and effective to some extent in order to get the work done and retain motivation among the employees. So, how great leaders inspire action. A TED Talk by Simon Sinek has given a very important or rather interesting golden circles aligned with our brain. So, let's know. So, it's a theory of value proposition which says or advises rather to start with the inner circle why. As you can see, the three circles, the inner circle is why. So you need to know when you work in a workplace, why is the purpose. So why you are working here, what is the purpose, what is the cause, what you believe in, that comes first, and it aligns with the emotions that lies in the limbic brain. Then comes the circle of how. So most of the people know whenever you are in a workstation, in a workplace, you know how to do it. If you know how to do it, then it will make you special, or it will differentiate you with someone who doesn't know how to do it. And the outer circle is what, which mostly focuses on the facts and align with the outer um neocortex of the brain, where most of the people, whenever we work, we know what we are doing. This is the basic thing, but we need to focus not only what, how, but why we need to do it. If you know why, then everything else will be falling in the place. So now we knew about public health leadership and its important various styles and how we could make it the best kind. But what should be the approach? The approach should be the precision public health. It's about population. It incorporates big data, consumer monitoring, new technologies, and other innovative tools to solve the most difficult medical problems in the world. This has already helped to cut HIV transmission from mother to babies by nearly half in South Africa, Sub-Saharan Africa, and now it's being used to address alarming infant mortality rate all over the world. So I would like to explain it with an example of a dengue epidemic. As you know, most of the time, the end of summer and starting of the rainy season, there are a lot of mosquito breeding, Aedes aegypti, which causes dengue. And a lot of children's adults die because of dengue fever, dengue hemorrhagic fever, where the platelets goes down, and dengue shock syndrome. But we it could have been prevented by simple measure of vector management, by practicing environmental anti-adult mosquito measures and personal protective measures by application of your net and use of insecticides. So by simple means we could have prevented it. That's what the precision means. We have to think globally and act locally to prevent the biggest problem in a simpler way. So, what should be the public health strategies? The goal is to save lives by bringing the right intervention to the right population at the right time after defining the problem. Once we know, we can address it by precision public health, that is, who, when, what, how, and bridging the gap between the two worlds, the rich world and the poor world, to save lives of millions. But yes, of course, we all, as a public health leader, need to be aware of the Dunning-Kruger's effect, where uh, you can see when you don't know something and you are unaware of it and your confidence is high, then you will be at the peak of Mount Stupid. But as you start to know, aware of the problem, your confidence will fall and you will be in the valley of despair, searching for knowing more about the problem. So as you start learning more, you become more competent and confidence will rise and you will rise or climb the slope of enlightenment. And when will you are fully aware and competent, your confidence will sustain and you will be at the plateau of sustainability. So we all need to know about it so that we could identify what is unknown and to solve it. So a great leadership is a network, not a hierarchy that someone will order and it will be done. So leadership being acquired by group of people in collaboration in a network. So a leadership is about asking questions, dare to show vulnerability and a real-time connection and collaboration. Is the power of few transferred to empower many, developing resilience and sustainability. For this, we need to remove the labels. As far as the labels are there, will not recognize our own capability. To make us comfortable, we need to come out of the box. We have to remove the labels. Likewise, we need to share everything. Keeping information to self, consolidating the power to self is not an advantage, rather a stupidness. So leader need to share everything to bring the effective outcome. And at last, leader need to be nice, be kind to each other. Not the pretend kind, but the kind leader who will help others to become the next leader, or you can say it will promote the growth mindset. So at the end, I would like to say, to create a better future, we need we all need to a better leader, a public health leader, and we all need to prioritize public health over anything else. Thank you so much. So I would like to end this session with few lines written by me. It's time to look inside you for a leader who doesn't act like a bottom feeder, who thinks deeper, fights for righteousness, yet strong enough to become a peacekeeper, who doesn't give order but works together, has vision, a dreamer, an achiever, thus called a true leader. Thank you.